all is well. Good afternoon, everyone. I hope everyone is well and safe today. My name is Sharon Stroy, the Director of Public Engagement in the School of Public Affairs and Administration at Rutgers University, Newark. It is my pleasure in recognition of Black Heritage Month. We are celebrating individuals who are making history in action. At this particular time, I would like to thank my co-moderator for this afternoon, Dr. Michael Dillard, the Assistant Teaching Professor and the Director of Undergraduate Programs in SPAA. And it is also my honor and privilege to welcome our guest speaker today, Darrell K. Terry, Sr., the current President and Chief Executive Officer for the Newark Beth Israel Medical Center and Children's Hospital of New Jersey. Today, we're going to engage Mr. Terry in some conversation and discussion about being a strategic leader in managing in a global pandemic. But at this time, I would like to officially introduce Mr. Terry. Darrell K. Terry Sr. is a 25-year employee of RWJ Barnabas Health and has more than 35 years of experience in healthcare administration at 3 major New Jersey healthcare organizations. He began his career at Newark Beth Israel Medical Center and Children's Hospital of New Jersey in operations management in 1997. He was named Senior Vice President of Operations in 2006, became the Chief Operating Officer in 2001, and in May 2016, he assumed his current position as President and Chief Executive Officer. In this role, Mr. Terry is responsible for the strategic operations of the 665-bed regional care teaching hospital, home to one of the nation's top 15 heart transplant centers that has performed more than 1,100 heart transplants, New Jersey's only advanced lung disease and transplant program, and a valve center that performs more cardiac valve procedures, including minimally invasive transcatheter aortic valve replacements, than any other center in the state. The Newark Beth Israel Robotic Surgery Program is the most experienced in Northern New Jersey. The Frederick B. Cohen Cancer and Blood Disorders Center and the Healthcare Foundation of New Jersey Breast Health Center provides seamless integration of cancer prevention, specialized care, and treatment options. In partnership with Rutgers Cancer Institute of New Jersey, the state's only NCI-designated Comprehensive Cancer Center, Children's Hospital of New Jersey, offers more than 30 specialized pediatric services, including New Jersey's largest Valerie Fund Children's Center for Cancer and Blood Disorders, and the Children's Heart Center that offers medical and surgical treatments for most complex cardiac abnormalities. Under his direction, Newark Beth Israel Medical Center has earned numerous consecutive A ratings for safety from the Leapfrog Group, several World's Best Hospital designations from Newsweek, a Best Maternity Hospital designation from Newsweek, and now ranks in the top 10% in the nation for patient safety according to Healthgrades. In addition, Newark Beth Israel ranks 4th in the nation for delivering inclusive care and has earned several recognitions from the Human Rights Campaign for its demonstrated commitment to LGBTQ inclusion practices. In his advocacy role, Mr. Terry has pioneered award-winning initiatives such as the Beth Challenge, Kids Fit, the Beth Greenhouse, and the Reverend Dr. Ronald B. Christian Community Health and Wellness Center. Mr. Terry is committed to improving the overall health and wellness of communities served by Newark Beth Israel. He is also committed to RWJ Barnabas Health's anti-racism initiative, Ending Racism Together. a graduate of Rutgers University with a concentration in business management. Mr. Terry received his master's in healthcare administration from Seton Hall University and a master's in public health from the Mellman School of Public Health at Columbia University. He is board certified in healthcare administration and a fellow in the American College of Healthcare Executives. Mr. Terry is a distinguished Paul Harris Fellow and a fellow of the New Jersey Healthcare Executive Leadership Academy. He sits on several boards and has received numerous awards throughout his career, including numerous community service awards and recognition. Mr. Terry has strong personal ties to Newark, Beth Israel. He grew up in the community, attended McGraw Avenue Elementary School, just blocks away from the hospital. He was also born at the Beth, as were two of his children. It is my honor and privilege to introduce Darrell K. Terry and my co-moderator for this afternoon, Dr. Michael Dillard, and I will turn it over to Michael to begin our discussion. Michael.
Well, thanks so much, Director Stroy. And again, on behalf of the School of Public Affairs and Administration, we want to personally thank Mr. Darrell Terry for joining us and, just taking a moment from his busy schedule. I do see that we have our Dean, Charles Menifil from the School of Public Affairs and Administration joining us. So I know he would like to share a few words of a welcome. Dean Menifil.
Thank you, Dr. Dillard. I appreciate it. I think that introduction from Director Stroy really paints the whole picture for us. We are very, very excited to have you with us today. Your resume speaks for itself. I mean, I was sitting here listening, thinking, wow, quite impressive. But we are an impressive group of people ourselves, so we like to stay in the same sort of company. I know you're going to expound some very good wisdom to our students today. So I will not detract you from getting to that. So thank you for joining us. Look forward to hearing your presentation.
Thank you, Dean.
Thanks so much, Dean. So, it's interesting in reading your impressive bio, your impressive resume, and all of the things that you've done. And when you start thinking about the nature of this course, servant leadership, both myself and Sharon Stroy, we started talking about ways in which we can, invite virtually and in person various guest speakers, leaders, to talk about their leadership journey, leadership and excellence, how they got to where they are. What were some of their trials and tribulations along the way? What were some of their challenges along the way? And we just started doing a process of elimination in terms of various executives in the community. And of course, your name came up because not only are you from the Beth, but you're from the community, from the South Ward of Newark, born and raised, or as I like to call it, born, bred, and buttered, right in the South Ward section of Newark. And so obviously this is near and dear to your heart. And so we're going to get started in terms of the questions. Both myself and Sharon Stroy will co-moderate this event. And we've developed some questions for you. So the first question we would like to know from you, sir, is share with us your leadership philosophy in dealing with diverse stakeholders at the Beth in terms of your leadership team, your employees, the patients that you provide services for, and the community.
So thank you for having me, Dr. Dillard and Director Stroy and Dean Menifil. It's a pleasure to be here. So let's talk a little bit about that. I actually was having a conversation earlier today about how challenging it is to run a hospital. So you have a diverse group of employees from all over the world. We have people here from probably about 72 countries. We have different levels of education. Up to and including a brain surgery, right? So you have all of these different professionals and trying to guide and get them all on one accord on behalf of our patients is a nearly impossible task. But we do it each and every day because the people who choose healthcare as a profession, they are the most incredible people that I have ever met. And it never became more obvious than when this pandemic started. So it's really an honor and privilege to lead these group of men and women through difficult times. So it is my style, to answer your question, is more servant leadership. Doctors and nurses, they are professionals. They know exactly how to treat a patient clinically. And what my role here is to provide them with the support that they need to take care of our patients. So my role is a supportive role. It's also an inspiring, motivating, and encouraging role. And so when the pandemic hit, I couldn't take care of a patient, but I can make sure that people had the resources they need to take care of patients. I can make sure that they knew that they had the support mentally and physically to do the outstanding job that they have continued to do throughout this pandemic.
Thank you so much. I just want to kind of spend some time talking about that a little bit for a second. And, when you started talking about key principles that we've discussed throughout the leadership journey, but more importantly, in the servant leadership course here at the School of Public Affairs and Administration. And you mentioned in terms of growth of the community, supporting your patients, empowering your employees, motivating them, especially during a given time as it obviously relates to the pandemic, the global pandemic that is COVID-19. But being able to listen critically to your staff, to your patients, and putting yourself out there. And that's really what it's all about. I always tell the students it's all about lights, camera, and action. You're on a center stage and everyone's watching, and what types of tools do you have in place to be that effective, engaging leader to motivate others? So that actually ties perfectly into the next question, which you kind of somewhat touched a little bit on, but with more than 30, and I want to kind of highlight that for a bit, with more than 35 years of healthcare administration experience, what prepared you for managing the still ongoing COVID-19 pandemic in the city of Newark? And obviously, the city of Newark was one of the first cities in the state of New Jersey dealing with the massive spread and outbreak of COVID-19. So what were some of your strategies as a healthcare executive, as a leader of Newark, Beth?
I tell you, there was nothing that I learned in school that could have prepared me for a pandemic. When the pandemic first hit, there was a lack of information. There was a lack of supplies. There was fear. There was anxiety. And what I decided to do was to be as visible as I possibly can. I came in every morning and I went to every unit of the hospital and talked to as many individuals as I possibly could. I would go home for a brief time and I would come back at night for the night shift and do the exact same thing. What I had promised the staff here at Newark Beth Israel was honesty. And the guidance was changing constantly. And the only thing that I could offer them was support and guidance as it changed, right? And so being present is 90% of the task, right? And so again, I can't take care of a patient, but I certainly can be here. There's so many different things that I did throughout the crisis, delivering food, delivering supplies, giving a shoulder to cry on. It was a pretty scary time for all of us and a lot of uncertainty. And one thing that they knew is that I was there with them. I was side by side with them throughout the most difficult time. None of us could have predicted that. So what I had said to them that, this is our time. So, when there's a fire, the firefighters come, right? When there's a crime, the police come. This is a healthcare crisis and it was our time. It was something like that we've never seen before and hopefully we'll never see again. I could not be more proud of my management team, as well as all the employees from dietary to housekeeping to nurses, doctors, residents, respiratory. Every single one of them stepped up and they walked into a situation that was uncertain at their own personal risk. We didn't know enough about this disease when it first happened. And so we all put ourselves on the line to make sure that we were there for our patients. And I prayed every night that people would come back to work the next day.
Well, you certainly led by example, in looking at some of the videos and just, again, being familiar with the Beth, it was so funny to see Darrell, obviously he was the patient transporter one day, then he was in the cafeteria the next day serving food. I mean, the videos are impressive, but you really showed your team that's what it's really about. And as we're preparing, inspiring leaders in the School of Public Affairs and Administration, it's not just about the title, but it's about your actions overall. And you certainly led through some turbulent times. I want to pass it on to my colleague, Sharon Stewart.
First of all, thank you. And who would have thought? We're talking about making history. This is Black Heritage Month. And in the past, we always talk about people who have accomplished great things and great feats, but we are living history right now. And his unprecedented global pandemic and you leading a major regional facility, I'm sure that there have been moments of tears and then moments of tears of joy and then maybe just tears of sorrow. Can you give, and I'm sure you probably have numerous memories because we're still in the throes of this pandemic, an example of one of your highlights and an example of one of the things that you felt was really challenging as the president and the CEO of this hospital?
Yep. So we had I'll start with the more challenging one first, and then I'll go on to, no, actually, I'm going to start with the great story first. So we had a physician here who was intubated and was very sick. There was very little hope. That doctor is practicing again today, and I could not have been happier to wheel him out of Newark Beth Israel. He's a great guy. Obviously, I'm not going to say a name, but it was dire. It was very dire, and the medical staff, the clinical staff, they did everything that they could do. God did His work, and this gentleman is back to taking care of patients, and that one was phenomenal. Every time I got to wheel an employee who was impacted by COVID-19 out of the medical center safely back to their home, that was exciting for us. The uncertainty, the death and dying was challenging. It wore on you each and every day. You always felt like you couldn't do enough to support your team. It was a very difficult time for all of us, but everybody stepped up and they did things that they never thought that they would have to do to get us through this crisis. I tell you, we overuse the term heroes in healthcare. They truly are heroes.
Awesome. And so, like Michael, Mr. Terry, I was born and raised in Newark, and currently a resident in the South Ward. Proud to say that my youngest child was born at the Beth. And so, I'm now in the office a couple of days during the week. But what I always find interesting, on my commute home, I drive up Lyons Avenue and drive past the hospital. You have a major renovation project going on. I see the workers down in the hole, digging deep. The facade of the building is removed. In the midst of a global unprecedented pandemic, you have a renovation project and a new vision of what the Beth is going to look like. How have you managed that? What has been your priorities? And what do you attribute being able to juggle still an ongoing pandemic and looking forward to the future? Because I'm looking forward to seeing what the finished product looks like.
Well, healthcare is a team sport, and you cannot do it without a great team. This construction project called Newark Strong is something that we are super excited about. So when you look at Newark Beth Israel, it was built, the major buildings were built in the 70s, and it looks more like a fortress. And it's not welcoming to our community. So when we contemplated this project, we wanted the community to know that it's about them. We wanted it public facing, we wanted light, glass, transparency, and we wanted to connect with the community in a meaningful way. And so that's what's about to happen here. By the end of this year, you'll see Lyons Avenue transformed. It's a $150 million investment in the South Ward. I certainly want to thank my colleagues up in Livingston at RWJ Barnabas Health for believing in us. The reason why we were able to do this construction project is because you talked earlier about our A ratings from Leapfrog, our patient experience, the great things that our employees have done from a quality and safety standpoint made us investment worthy. And so this community was certainly worth investing in. This project expands our emergency department and renovates it, creates two brand new geriatric units. It's a new OR, new cath lab, a brand new ICU. You talked earlier about our heart transplant and lung transplant. And so we wanted to make sure that our external and our internal match the great care that's being provided here on a daily basis. And so how did we do that in the midst of a pandemic? I don't even know, right? We just put one foot in front of the other and try to limit the disruption to our patients, because we still had to see patients each and every day while trying to build. It's like flying, changing a tire at 65 miles per hour. But with the great team that we have here, we've been able to successfully navigate both of those situations, pandemic as well as a major construction project. And, until you said it, I didn't even, put it together. It's just what we do each and every day, putting one foot in front of the other and doing the next best right thing for our patients. For me, our patients are our North Star. And as long as we keep them in the forefront of all of our decisions, then we generally make good decisions.
And it's so interesting when we talked about it, that, and when we talk about, servant leadership, Michael and I talk about all the time about, yes, we are the School of Public Affairs Administration and we are teaching theory. We have world-class faculty members, but how do we connect what they are teaching in the classroom to what is actually going on the ground in practice? And when you talk about servant leadership and your patients are your North Star, that is the mission, and as to what Michael is teaching in his course and what the students are getting from it. And here you're living it. And so it's bringing theory and practice together in true form. Michael, follow up with some questions.
Oh, absolutely. This is a dynamic discussion. And, and that's really what it's all about. It's more than just theory. And Sharon and I, we knew this 10 or 15 years ago. We always talked about this, right? This idea, this concept of, you need more than book smarts. The theory is great, but you have to be able to apply that theory, in order to be a successful public administrator in all different facets, in all different industries, and healthcare is just one of them. And Newark Beth is certainly a prime example or epitome of what success and leadership overall looks like. And as we're, kind of coming to an end in terms of our questions, I also want to be mindful with the audience. Please place your questions in the chat box feature, because again, this is a rare opportunity to have someone such as a Mr. Darrell Terry to join us from his busy schedule. So please, and you know how Professor Dillard is, if not, I will call on you. So you don't want Dillard to call on you. So please place your questions over in the chat box as it relates to just, certain questions or comments for Mr. Darrell Terry. So obviously we know too, with being an effective leader is also about strategic planning, strategic thinking, having a vision, not only as a leader, but foresight. Where do you see the organization going, years from now, whether it's a 5-year plan, 10-year plan, a 20-year plan. And that's part of thinking today of what tomorrow will look like for Newark Beth. So the question presents as simple as so. What is your 5 to 10 and perhaps 15-year vision plan for Newark Beth?
So I take it personal every time someone who lives in Newark gets in their car and they drive to some suburban hospital somewhere. I want the residents of Newark to have complete trust and faith in the kind of care that we provide here. I want it to be very comfortable for them, but what more importantly, I want to improve the health status of the community that we serve. When you look at all the metrics around health, Newark generally comes in, towards the bottom as far as all health outcomes. So it's not enough, all this great things that Director Stroy talked about in the opening. It's not enough. If we still have maternal mortality where Black women are dying 3 and 4 times that of their white counterparts, we're not doing a good enough job. So until we can reduce those disparities, until we can improve the health status of the communities that we serve, then I haven't done enough. I need those metrics to change. We need to get better at everything, but we need to provide access where people are, not sit back and wait for people to come to Newark Beth Israel. We need to meet them where they are. We don't want to meet them in the emergency department. We want to meet them where they are. We want them to be able to trust us and know that we are credible. So when vaccines come out, they're listening to us rather than the misinformation that's out there on the internet. So building trust in what we do here and why we do it is something that's critically important to me. Because when people don't take the vaccine, I see what happens. Like I see the other side of that. I see that, at the height of the pandemic, this second wave, 80% of the patients who were unvaccinated were admitted in our hospital. When you went to the ICU, 90% of those patients were unvaccinated. So we had the cure, we had the thing that was going to prevent that. But because of trust and disinformation, people didn't take advantage of it. And, that was frustrating because a lot of that could have been avoided. And so for me, we can talk about, nice buildings and the like, but until we improve the health outcomes and reduce disparities, then we haven't done enough.
Absolutely. And I'm really happy to see, I'm looking at the chat box feature, and I know Director Stroy, you're managing it. I see we have a number of questions coming in, so we're going to have some great dialogue after this panel discussion. But one of the things that we often at times we talk about, particularly obviously we're approaching commencement, and it's great to, think about and celebrate pomp and circumstance, but, what does the job future look like for you? Once it's all said and done, once you finish that degree, so we have a number of students that are interested in healthcare administration. So we want to be able to hear from you, someone at the top of that organization, then, in terms of, well, what is Newark Beth exactly looking for in today's graduates, particularly those that are interested in healthcare administration?
So one thing that I'd have to say is, and it's become so obvious with the pandemic, is that this is not really a job, it's a profession. And it's a commitment, it's a calling. So what we're looking for is people who are totally committed to the mission of improving the health status of our communities. If you're coming into a hospital for just a job, it's probably not a great idea. And when we went through the pandemic and we were asking people with multiple degrees to take out garbage or deliver food, then it became very obvious that, this is something different. And so for me, what's worked for me during my career is ownership. Every single job that I had, I felt like I owned the facility that I worked at. And this kind of goes back to when I was a kid and I worked in the store in East Orange. I felt like I owned the store. Right. So the guy who did own the store didn't have to tell me to, straighten up this or clean up that. In between customers, I would go do whatever it was required to make sure that we were ready for our customers. And every single job that I had, I felt like I was the owner. And ownership versus rentership is very different, right? When you own something, you treat it very differently than when you rent or lease or whatever. So I think that it's really important that the next group coming in, I think that they're technologically savvy, which I'm not. They are smart. I'm caring. I'm committed. So I have full faith and confidence in this next group of people that's coming on board. What they don't like to do, and it'll sound a little negative, but it's really not, is, I came from the generation of sort of paying your dues. Now, oftentimes people want to come in and be the president in a year. It's been a journey. It's been a journey, and it generally takes a lot of hard work and experience and commitment and failure in order to get to where you need to go. There's no shortcuts. There's no such thing as a shortcut. It's generally the longest way. But I do have full faith and confidence in this next generation. I just hope that more people involve themselves, more people who look like me involve themselves in healthcare, because we need it. We need credible Black and brown leaders to build trust and credibility within the communities that we serve.
Well, it's funny, before Sharon jumps in to take over, I wanted to say too, we were really strategic, and you just said something, sir, in terms of, having folks that look like you. And, obviously this is Black History Month. And, so we started thinking of, again, a number of healthcare executives. I'm like, wait a minute, hold up, time out. We gotta reach out to the Newark Beth. We got this brother managing, Newark Beth. He's been there for quite some time. He's born and raised right in the city of Newark, right over in the South Ward. I've lived over in the South Ward for a number of years. We gotta have this brother to come in to talk. But it's more importantly in terms of just some of the other things that you really touched up on, in terms of, not being too proud, not forgetting exactly where you come from, realizing that you got to put the work in, or as Sharon and I like to call it, you have to dress for the position that you ultimately want. But not only just dressing for the position that you want, but acting in the position that you want. People will see that good work in you. People will see, and I'm looking at the chat box in terms of, just your overall traits, your qualities. That's something that you can't fake. And that's something that a textbook can't somehow prepare you for. It's just something that you have to have deep within you, that type of drive, that tenacity, that motivation. But it's all of those years of preparation, that prep work that got you to becoming that president and CEO. And you clearly certainly haven't forgotten that. And too often at times, and I know I've been there too, I can't wait to finish my degree. I want to be the top man in charge. I want to be the boss. But the humbling experience is picking up those garbage cans, sweeping out in front of that building, making sure that you really understand from soup to nuts all of the many nuances of an organization, because to get to the top, and we know this as leaders, it's certainly challenging to stay up at the top, but you have a good idea to be able to make it once you reach the top, because you've done so many other opportunities within that arena, within that organization. So that's been a schooling in itself, beyond just your 2 wonderful master's degrees and all of the number of certificates that you have, sir, but just all of the other experiences that you've had at the Beth, and 35 plus years, because we got to add that in. You may not look like it, but he's had 35 years of healthcare experience to get him to this particular point. And that's what it takes to stay in those positions. I'll turn it back over to Director Short.
First of all, thank you, Mr. Terry, for your comments and remarks. And I cannot wait to get into this chat box. But before we start with the questions, I want to share what one of our attendees placed in the chat. And it is from, please forgive me if I pronounce your name wrong, Sherrod Delane. Sherrod said, just wanted to say it's an honor having you. I was personally able to interact with you when I had my son at Beth Israel 2 years ago, and you came in to ask how the experience was. Just wanted to say, after I got your business card, you actually gave me some inspiration as to what to continue my education in. So even when you're not on the Zoom camera, Mr. Terry, evidently you have been leading by example. So I wanted to share that from our attendee, that this is proof that you live by what you say.
Thank you. Thank you.
So the first question, especially from students, is, was healthcare your first career choice?
Great question. So as an undergrad at Rutgers, I had no idea what I wanted to do. I just knew that I needed a degree to do whatever I wanted to do. So I had 10 family members I have a very strong family, a great family. They keep me grounded. I know on Monday and Thursday is garbage days and Thursday is recycling days because I got to do it. And I have an unbelievable family who's always been very supportive. Back then, when I was at Rutgers undergrad, I had 10 family members who were working at University Hospital. And so I started there as a summer job, and I fell in love with healthcare then. Although I stepped away from it for a couple of years because I wasn't making enough money, I came back to it when my mom got sick and she was admitted to a hospital in Orange, New Jersey. It's now closed, Hospital Center at Orange. And the way they treated my mom and the caring, kind heroes that worked there, it reminded me of how much I loved working in the healthcare environment. And I jumped back in with both feet and have not even considered leaving since then.
Thank you. Thank you. Our next question. How does the hospital navigate patients that are underinsured or uninsured in the community?
So we are blind to insurance status. Everybody is treated here based on their clinical needs. Now, what we do is support folks who have social needs that are outside the general clinical world. That nobody is given different medication because of their insurance status or wait long or a different kind of room or anything like that. And I'm really proud of how we take care of all of our patients. Now, what we have been doing in the last several years with system leadership, with RWJ Barnabas system leadership, is social impact and community investment. So we are looking at the inequities. We are looking at some of the social aspects of what makes a person healthy. And we are investing in those areas. We have a greenhouse on Osborne Terrace. I don't know any other hospital that has a greenhouse. So we are able to provide fresh fruits and vegetables to our community. So we are looking at the underinsured and uninsured, not in a negative way, but in how can we provide better service to them? How can we make sure that we improve their health status? Employment is another thing that we look very closely on. If you don't have a job and you can't put food on the table, you're not going to get a mammogram. You're not going to get a colonoscopy. You're not going to get those things that we all associate with good health. So we had a Hire Newark program here at the Beth, where we took Newark residents that were difficult to employ. We trained them, we hired them along with our community partners, and Rutgers was actually one of our community partners. And so we want to make sure that we create economic opportunity. The $150 million transformation project, Newark Strong, that you talked about earlier, with 30% of that is set aside for minority and women-owned and veteran businesses. We want to make sure that this spend really impacts our community in a meaningful way.
Thank you. And actually, you kind of alluded to another question where the attendee asked about Essex County has the highest rate of food insecurity in the state, and the attendee wanted to know some of the community initiatives that the Beth is implementing to help address food insecurity.
In addition to, around holiday times, everybody's doing a lot of things. So we do too, of course. But every pregnant woman that comes to our service, they go over to the doctor, Reverend Ronald Christian Health and Wellness Center, and we give them groceries after their visit. We give food vouchers. Again, the greenhouse is something that we created to make sure that people had access to fresh fruits and vegetables. And we do lots of education. The education is cool, but it's not enough. I mean, we can tell people how to eat healthy, but if they don't have either access to healthy foods or the financial wherewithal to get them, then, the education is fine, but it's not enough. So we continue to work with our community to help any way we can. We partner with the community food bank to make sure that people have access to food.
And so I believe our attendees are really concerned and asking and curious about, outreach to the community after 2 years of the pandemic. These definitely would be some of those questions. So another question goes to, you talked about your 5-year plan, but I think the question is referring to what other type of community outreach? You say the attendees say you make sure you get out to the community. So they would like to know, how are you getting out to the community? What is some of your other community outreach initiatives?
So prior to the pandemic, we were out in the community almost every day. We have a men's health night at Newark Beth Israel, where we take men. Generally, the last time we did it before the pandemic, we had 300 men. We go to Maplewood Country Club. We have George Martin, the ex-Giant football player, who's the moderator. We have a panel of physicians, and we have all kinds of tests and treatment there. And so what we do is the panel discussion goes on, and everybody's asked all the questions that they need to ask from our professionals. It's a great health event. We do screenings and the like, and then we watch Monday Night Football together. And it's an event that many men look forward to each and every year. And we have a lot of people who come back. It has grown every year since we started it. Women's Health Day started off 40 people in our cafeteria. The last time we were able to do it in person, it was at the Marriott with over 600 women. So every year we have the Alma Beatty. Alma Beatty was the first Black administrator at Newark Beth Israel Medical Center. And me being the president, I stand on her shoulders. Without an Alma Beatty, there would not be a Darrell Terry here. She started a health fair every year where we shut down Lyons Avenue, and we provide all kinds of tests and treatment and make sure that we open up the entire medical center to our community. This year, in a lull in the pandemic, we were able to do it. We did it at Bo Porter Park on Lyons Avenue, and it was great going off campus and really being part of the community that we serve. There are a bunch of other initiatives. We have a senior wellness action team. We have a home friends program where we do light chores and shopping for our seniors. The Higher Newark program, the Clinical Ladder program, certainly the Kids Fit program, where we go into schools and talk to kids about healthy eating. There's a bunch of things that we do with and for the community. Now, a lot of this stuff has been paused or put into a more virtual forum, which is less effective, I think. I certainly prefer being in person. The other thing that we have that's really important is white coats for Black lives, because our doctors are very interested in making sure that they are a part of this community and make themselves available. They get excited going out to churches and to other venues to talk to the community about their health.
Here's a leadership question. How do you make leadership so easy when I know it is so the opposite? What makes you struggle at night? What keeps you awake at night?
The easy part for me is, and I said it earlier, is having a North Star. Having the patient as a North Star makes this sort of easy for me, because whatever the decision that needs to be made, no matter how complicated it is, when you think back and say, how is this going to impact either your patient, your community, or your employees, you generally make the right decision. It is very challenging. I worry about our employees. I worry about safety. I worry about our, making mistakes and harming our patients. Those are the kinds of things that keep me up at night. The emergency department is, a volatile place. We see almost 100,000 visits a year in our emergency department, and there's a lot of mental health challenges everywhere. And so I worry for our staff. I worry that, something bad is going to happen. And those are the kinds of things that keep me up at night.
A follow-up, I'm gonna come back to that, but a question that is coming up. As a leader, one of the things that is important and we want our students to understand is that you have to have a budget. And so you talked about some really deep community initiatives that seem to be part of your budget. How do you manage the responsibilities of the hospital, payroll, salaries, but also having a portion of your budget allocated to serving the community?
And you're absolutely right that, no, the only way we're able to do these kinds of things is if we're financially successful. So looking at metrics, making sure that we are financially astute, but we also factor in that we believe that these things are important. So your budget is an indicator of the things that you value, the things that are important to you. So if we value improving the health status of our community, then we have to set aside a portion of our budget to accommodate that. But it's a challenge, and it's been particularly difficult during this pandemic time because people were delaying their health care. They were afraid to come in for health care. Even during the lulls, our patients were slow to come back to Newark, Beth Israel. And what concerned me about that, less than the money, is that their disease state is more advances, right? So if you had a stage 1 cancer, it might turn into a stage 2 or 3, or if you had heart disease, it might become more advanced. So it wasn't really about the money, although it did have negative financial consequences. It's more about making sure that people got here to take care of their health needs. And so yes, it's been a struggle the last couple of years financially, but we are committed to our community and putting our money where our mouth is.
Awesome. One of the attendees placed a comment and question about they had to do a paper on the mortality rates of Black women versus their white counterparts. And as a person of color themselves, they were apprehensive about going to hospitals in Newark and in East Orange and chose to go to other facilities. How do you combat the fear and the mistrust of especially for women and their child, their maternity health care, and to have them come to the Beth and know that themselves and their child will be okay?
So studies have demonstrated that racism plays a big part in those outcomes. So to go to a more suburban facility that is less African American might not get you what you think it's going to get you, right? So here, and my staff will be the first to tell you, I am committed, I am obsessed with that particular metric. And we are very meticulous as to how we take care of our pregnant patients from the time that they know that they're pregnant to after they give birth, and then a year afterwards. So we have programs now where when you bring your child in for the first baby visit, we take your blood pressure to make sure that you're okay. We have something here called a code Venus, right? And so if you come to our emergency department and you had given birth, a whole team comes down to make sure that you're okay, even if you come there for a broken arm, right? Because we want to make sure that we do our part to reduce maternal mortality. Does racism exist at Newark Beth Israel? Of course, yes, of course it does. It exists everywhere. But as long as I'm here, I do feel as though we have a really good chance of sort of reducing the disparities. And I know that we're focused on making sure that we provide great care. The chairman of our OB department, Dr. Sawajid, is an outstanding individual, a great leader, and I have full confidence in his ability to lead that department. So, other hospitals are good too. I'm certainly aware of that. But if you're worried about maternal mortality and racism, it is a major component of why that disparity exists. then I would caution folks going to places where there are people who don't necessarily look like them or have the same commitment.
What do you do for your personnel in training and educating them on, not indulging in racist behavior? What type of trainings are your personnel involved in to, really address this issue? Because racism, do you consider racism a public health crisis at the Beth? Because it is everywhere.
It absolutely is a public health crisis, and having a Black president does not change that. Right. So to be clear, but I am absolutely focused on it. I hired the first chief equity officer in the history of Newark Beth Israel Medical Center. Our system has a ending racism commitment from the board level on. We are our board composition is changing to be more reflective of Black and brown people in the community that we serve. Our leadership team is extremely diverse. It's important that you have the right people in the room to make decisions, and that diversity of thought, diversity of education, diversity of race. We need to make sure that and I do have the ability to make sure that the right people are in the room when decisions are being made that impact our community. So one of the best parts of my job is I oftentimes get to frame the argument, right? So I get to choose our priorities. And so, ensuring that the right people are in the room and that we're looking at things through an equity lens is really important. When we're evaluating new programs or new offerings to our community, we have an equity assessment tool that we use to make sure that there is no disparate outcome that we had not anticipated. So we're all over it. Our chief equity officer obviously sits on the senior management team. They're involved in hiring decisions. They're involved in every major decision that we have here at the Beth.
Awesome. I'm excited to hear that, because it definitely is something that I work on as the director of the Truth, Racial Healing and Transformation Center. But we are the School of Public Affairs and Administration. And, as a SPAA alum, I think we're the best in the region, but I could be a little biased, but we are probably the best in the country, but, that could be my bias. But we do have world-renowned faculty. And we need to make sure that when our students are in classes, that they are getting the best education. What can we do? What can our faculty do to help prepare students for the industry of healthcare?
I think one of the things that we can do is have some of our leaders interact with students so that they can get real world experience or observations, learnings from a group of people who are committed to improving the health of our communities. So I'd love to work more closely with Rutgers to produce some of the great talent that we have here. So you're talking to me today, but I have a great leadership team who can go out and meet with your students and talk to them and tell them, the real deal about what this healthcare thing is about, right? It's not a job, it is a profession, it is a calling. And if you're really not committed to it, you should probably do something else.
My final question, and it is actually something that one of the attendees put in the chat. We're talking to an executive leader with, as Michael stated, 30 plus years of experience. Where is leadership taught or learned?
Where is it taught or learned? It's taught or learned everywhere, every day, in different situations. It's taught at home, it's taught in school, and it's taught through your experiences.
Awesome. Darrell, Terry, thank you. Michael, closing comments before I close this out this evening. I first want to thank, I'm sorry, Michael. I want to thank all of our attendees for their questions. Please excuse me if I didn't ask your questions, but some of your questions did overlap. I am excited about your interest in the community, and we will definitely continue on this conversation with Mr. Terry. Michael, and then Dean Menifeld.
Thank you so much, Sharon. And again, it's been a pleasure working with you, putting this event together. And, that's what it's all about. And we try to show our students. It takes a team to make this happen. And, calling Sharon every day. Hey, what about this question? What about this idea? What about this thought? But literally, we want our students to know, what does it take to actually put events like this together? And, and I'm proud of all the students that showed up. But also, I want to just say to the audience members, be sure to check out our SPAA Facebook. We have some dynamic events that are continuing to happen throughout this academic year. As a matter of fact, we have another panel discussion that's coming up this Monday, February the 28th at 10 o'clock. And we have some dynamic leaders coming in. I won't say all their names because, again, we don't have enough time, but check out the flyer on Facebook. But again, we want you engaged with us. And Darrell, we're going to take you up on your offer in terms of sending students. So trust me, we will be over there either in car or taking a 39 bus over to Lyons Avenue. We will be there, and we're going to show up in high numbers, because that's really what it's about. It's not just in terms of having the degree, but more importantly, being able to build your social capital, being able to network with key executives and executives that look like us, and I think, again, it's beyond just simply SPAA. It takes an entire team to pull this off. I think Linda Kamade, your assistant VP, who I was able to call and bug every day. Well, Linda, can we change this up? What about this? What about that? And she made it happen. I think all the executive assistants over there, Vashti Miller, again, this was an entire team. And anytime that I called on Newark Beth, it did not matter the day or the time, they answered that call. How can we help SPAA students? And that's really what it's overall about. So again, Darrell, we say thank you. I'm going to turn it over to Dean Menifeld.
Thank you. We have been honored with your presence today. It's nothing like having someone who's dedicated to the city and the community that we live in. It's always very helpful to see a man of color in your position. I'm going to echo what Michael just said. It's very important to me as a dean of the school that we are properly training our students to engage in higher levels, particularly in the healthcare profession. I have interest in healthcare myself. So we're going to do our best to make sure they're prepared, and we will certainly take you up on creating some venues and some avenues for us to further collaborate and some direct channels to get our students involved.
On behalf of the faculty, staff, students, and alumni, community partners in the School of Public Affairs and Administration, we want to thank all of our attendees this evening. Please feel free to follow us on Facebook, Instagram, LinkedIn, and Twitter, and look forward to our next executive conversation in March for Women's History Month. Be safe, take care, and have a great afternoon.
Thank you. God bless you.
Thank you.